Hello, I'm Dr. Ramsey Amin. I'm going to talk with you today about zirconia dental implants. Now, I'm not talking about the actual abutment or the crown itself. I'm talking about the implant itself. There's a lot of people out there that are looking at having zirconia dental implants as opposed to traditional titanium alloy dental implants. One of the reasons people look for this is because some people believe that they do not want to have metal in their body at all. Zirconia is a type of metal. It's been around for a long time. It's very successful in making the parts above the gum line. That we have a lot of clinical success rate with, especially the crowns, bridges, and some of the abutments. But the implant itself, my bottom line is the jury is still out. Zirconia dental implants are typically one piece. That means that there is no removable abutment. What does that mean to you? It means that if the implant is even put in a slightly wrong position, it is uncorrectable. A two-piece implant can have the top of the implant unscrewed and replaced to a different angle, a shorter, taller, a wide variety of what we call margin heights, where a one-piece implant, you're pretty much locked into what you have. It can only be cemented. It cannot be held by a screw. It can only be drilled on inside the mouth. But the biggest question, the biggest problem with zirconia dental implants is there is no long-term data. At most, maybe 7 to 10 years at the most. I can tell you I would not place it on my own family members. Why? Because they fracture. They do break inside the jawbone. They break off typically level with the top of the bone, because zirconia by nature, when it's thin, can be a weak substance. Zirconia is not designed typically to be made thin, or it is prone to fracture. That's true of whether you're making a Prettau dental implant bridge, a single unit crown. It has to have material thickness to be able to withstand the forces. Titanium dental implants have been around for 40 plus years at this point and have a very long track record of success. There is no immunology that reports that there are allergies to titanium dental implants. They are used in hips and other types of medical devices. In fact, zirconia was used and still is today for some hip replacements, which they've seen some of the hip replacements fracture at the 10-year mark because of what they call thermal degradation, low temperature thermal degradation. That means that the temperature inside the body may not be substantial enough for zirconia to keep its what we call tetragonal form, that it actually holds together and does not break down. The bottom line is, I would say that for now, I would not place zirconia dental implants in the jaw. I would stick with titanium only. Maybe in 5, 10, 15 years from now that will change. But titanium works very well. It does not have any reactions inside the body. And there are no studies to show that it is harmful to the body. Whereas zirconia, we have seen that it's not harmful, but it just doesn't last. So why do something experimental that you're locked into? What if you lose one tooth and need to attach it to your zirconia implant? Well, you really can't, because it has a one-piece implant. It can't be re-cemented or re-screwed or reattached to another bridge. You're just kind of stuck with it. I've had to cut out and remove some of these from the jawbone. They're not easy to take out. There is no hex to engage them. They have to be cut out of the jawbone, and we typically lose quite a lot of jawbone in the removal. Again, that's my take on zirconia dental implants as of 2015. I've placed many thousands of implants and removed quite a number of them too. And the bottom line, it comes down to the engineering, the skill of the surgeon, and really your own ability to heal, and the design of how your teeth are made. Your teeth undergo a tremendous amount of force on a daily basis. So to subject them to something experimental that's going to be permanently inside the bone, I don't know. Can't do it. And not yet. Maybe we'll revisit this topic in a few years. Take care. Thanks for listening, and we'll see you soon.